According to the Centers for Disease Control, of all the cancers that affect both men and women, colorectal cancer is the second leading cancer killer in the United States. But with early detection, it doesn't have to be. Here to share more information about colorectal cancer and keys to fighting it is Gastroenterologist Dr. Anuj Manocha. Hi, Dr. Manocha. Thank you so much for joining us.
Hi, thank you for having me.
Pleasure. So it seems to be like a no-brainer, but I want to make sure that everyone understands what exactly is colorectal cancer.
So colorectal cancer is cancer of the large intestine, or colon and rectum. And what we've learned is that all colon cancer starts with something called colon polyps, which are benign growths in the colon, but if left undetected can turn into colon cancer.
Okay, so how would someone know if they had colorectal cancer?
So this is the key to colon cancer. You talked a little bit in your introductory segment about prevention and treatment and early detection. The key to colon cancer is detecting polyps, and unfortunately polyps don't give any symptoms whatsoever. So what we've learned is that patients need to undergo a test to look for polyps, and that's what we call screening, or colorectal cancer screening.
Okay, is it painful? Can you talk to us a little bit
So
about
screening is a test called a colonoscopy. There's a lot of myths and thoughts about colonoscopies, this, that, the other. It turns out that colonoscopies are actually very easy to perform.
Okay.
So they are invasive tests, but all patients are sedated for the test. They don't feel any pain or discomfort at all. And what we've learned is that with the colonoscopy you can find something called colon polyps, remove the polyps, and stop cancer from ever developing.
Okay, so this is a way of prevention,
Correct.
right?
Correct, and that's the primary way that
Okay.
we've learned. And over the last 2 decades, we've learned that colon cancer is actually starting to decrease in incidence and mortality, and it's because patients are now undergoing screening tests like a colonoscopy on a regular basis.
Okay. Are there any other ways that people can lower the risk?
So there's some other risk factors we've learned that are related to colon cancer. Obesity is one thing, and that's related to a sedentary lifestyle, excessive tobacco or alcohol use, excessive use of red meat. All these things can decrease the risk. They can't prevent it, but they
Right.
can decrease the risk.
Okay, so if people want to find out more, and how can they reach you in the Atlanta area?
So we're a large practice. We're 22 board-certified gastroenterologists. We're on the north side of town. We have 8 locations, 3 endoscopy centers where we do the colonoscopy. The best number to reach us is 678-741-5000. And we have a website, gigeorgia.com. And the best way to get the colonoscopy scheduled is a simple way, 1-888-MY-COLON.
Oh.
Call the number, we can schedule the colonoscopy over the phone, and that one call can save your life.
Awesome. At what age?
We start at age 50
Okay.
for the general population, and we've learned that if you have a family history of colon cancer or colon polyps in a first-degree relative, that's mom, dad, brothers, sisters, you start at age 40.
Okay.
The other
great.
thing, one important part is African Americans.
Okay.
We've learned that they start at age 45 because we see an earlier incidence of colorectal cancer in African Americans.
Okay,
So-
lots of information. Dr. Anuj Manocha, thank you so
Thank
much for
you.
joining us.
Thank
I
you.
appreciate it.